Hello, my name is Fernando Delgado. My topic is chlamydia complications. Definitions. Chlamydia, also known as chlamydia, is a common bacterial infection that is easily cured with antibiotics. It can cause serious and permanent damage to a woman's reproductive system. This can make it difficult or possible for her to get pregnant later. Chlamydia can also cause a potentially fatal ectopic pregnancy that occurs outside the
This is Chlamydia trachomatis. Chlamydia generally likes to enter cells, hang out in bodily fluids, and often shows up when least expected. For one tiny bacteria, chlamydia really gets around. There have been over 3,800 cases in Ottawa in the past year alone, and those are the ones we know about. Chlamydia enjoys traveling through contact with bodily fluids during unprotected oral, vaginal, or anal sex. This type of sneaky bacteria can hide in the human body without showing any symptoms. If chlamydia does decide to show itself, it could be anywhere between 2 to 6 weeks after contact. Symptoms can include discharge coming from your genitals, burning when you pee, stomach pain or pain during sex, abnormal bleeding. Because there can be a lack of symptoms, the only way to know if you have chlamydia is to get tested. The best way to test for chlamydia is through a urine sample or for a health professional to take a swab of your throat, vagina, penis, or rectum. It is important to get tested. If left untreated, chlamydia can cause pelvic inflammatory disease, an infection in the fallopian tubes, uterus, and ovaries, infertility, ectopic pregnancy, a pregnancy in the fallopian tubes, infection in the testicles. Chlamydia hates being detected because once we know it's there, it's simple to treat with antibiotics. Protect yourself by following these three simple rules. No sex for 7 days after treatment. Make sure your partner is also tested and treated. Use protection. You can get chlamydia again even if you've already been treated. So remember, if you want to prevent chlamydia from becoming your next travel companion, use condoms and get tested regularly. Following these easy steps will keep you and your partners safe.
application in odontology. Risk of chlamydia infection in the throat. Your body is so busy fighting off the chlamydia bacteria, it doesn't fend off other infections as effectively. This can cause problems such as mouth infections, tooth loss, gum disease, and dental pain.
What is chlamydia? Did you know that chlamydia is one of the most common sexually transmitted infections in the world? Most people with chlamydia have zero or no symptoms. The good news is that it's easy to diagnose, treat, and prevent. Why should I care? Here are the problems chlamydia can cause: painful urination, discharge, inability to get pregnant, abdominal pain, and increased risk of HIV. How do I get it? Chlamydia can be spread through sexual contact, either oral, vaginal, and penile or anal. How can I prevent chlamydia? With the use of condoms, either vaginal or penile, dental dams, or through abstinence. Does the use of condoms guarantee I won't get chlamydia? Well, the answer is no, but it will greatly reduce your risk. What do I do now? Well, if you are or have ever been sexually active, it's important to get tested. You should get tested with every new partner and ask your partner or partners about their sexual history and insist that they get tested too. How do I get tested though? See, the good news is testing is easy and available to you as a student. Samples are drawn through urine or self swab, depending on the tests being done. You can go to the UCI Student Health Center, check out their website, or see your medical provider to get tested. There's also free, anonymous, and confidential testing throughout Orange County. Please visit the OC Healthcare Agency for locations. Hashtag Know the Facts.
Pros. Chlamydia can be cured with the right treatment. It is important that you take a lot of the medication your doctor prescribes to cure your infections. When taken properly, it will stop the infections and could decrease your chance of having complications later on. Cons. Although medication will stop the infection, it will not repair any permanent damage done by the disease. If a person's symptoms continue for more than a few days after receiving treatment, he or she should return to health care provider to be reevaluated. Repeat infections with chlamydia is common.
Chlamydia is a bacterial infection that's primarily sexually transmitted. Most folks who have chlamydia actually don't have any symptoms, but it can cause a lot of inflammation that can be uncomfortable and can also be associated with infertility. Symptoms associated with chlamydia include urethritis, so pain with urination in both men and women. In men, it can also be associated with epididymitis, so a painful swelling of the scrotum. Most of the time, women are asymptomatic, but can also be associated with vaginal discharge and pain with urination. Usually when someone comes in and we make the diagnosis of chlamydia, the treatment regimen is a single pill, sometimes associated with a single injection that we can also give in the clinic.
Issue at play in Ecuador. Chlamydia trachomatis infection in Ecuadorian pregnant adolescent attending the SAIA of the Hospital Ginecobstetric Isidro Ayora of 41 due age percent is higher than in most studies carried out on call due to the study populations. Adolescent and pregnant women with biological conditions at higher risk than adult women over 25 years of age or
In 2015, a high school in Texas experienced a mass chlamydia outbreak amongst its students. It should be noted that the high school only taught abstinence-only sex education. So basically, hormones plus teenage rebellion minus proper sex education equals a chlamydia outbreak. So how do you prevent a chlamydia outbreak? First, you need to know how it's transmitted. You can get chlamydia through oral, anal, and vaginal sex. Then you need to know how to spot it. Chlamydia can cause painful urination and discharge. In those with a penis, it can cause pain and swelling in the testicles. And if you have a vulva, you could experience pain during sex. But all of those things are also symptoms for other diseases, so they get discounted and people go to the drugstore and they think like, oh, I have a urinary tract infection or I have a yeast infection or something else. A couple years ago, a person I was dating got in touch with me and told me they just gotten tested and they had chlamydia. And even though I'm a sex educator, I freaked the fuck out. And then I stopped and I remembered all the things I knew about chlamydia. One, I found out about it early, which is great. And two, I could easily treat it with antibiotics. I went to my doctor and I told him that I might possibly have chlamydia, and he took the test, but he also just offered me the antibiotics up front because by the time I'd get the test back, I could also be done with my run of antibiotics. It was actually the easiest thing I've gone through. And a lot of people don't know that. They think that when you get something like this, that you're gonna go through the whole myriad of symptoms before you finally go get treatment. And this is why talking to your partner and just the people you sleep with, period, is really important. We can prevent all of this by using barriers and getting regularly tested after new partners. But if you think you've already contracted chlamydia, don't freak out. It's treatable with a short course of antibiotics. And remember, you're not alone. I've been there too.
Conclusions. The initial damage that chlamydia causes often goes unnoticed. However, chlamydia can lead to serious health problems. If you are a woman untreated, chlamydia can spread to your uterus and fallopian tubes, tubes that carry fertilized eggs from the ovaries to the uterus. Men rarely have health problems linked to chlamydia. Infection sometimes spreads to the tubes that carry sperm from the testicles, causing pain and fever. Rarely, chlamydia can prevent a man from being able to have children.
Chlamydia is a sexually transmitted infection caused by the bacterium Chlamydia trachomatis. It is the most common bacterial STI, mainly affects young people 15 to 24 years of age, and is more common among women. Between 1997 and 2011, the number of infected people nearly tripled. The people most at risk of chlamydia are those who have multiple sex partners, those who practice unsafe sex, and those who have a history of other STIs. In men, symptoms can include a discharge from the penis, pain while urinating, along with tender or swollen testicles. The symptoms resemble those of gonorrhea. They can appear intermittently or disappear completely while the person remains infected. In women, symptoms include an abnormal vaginal discharge, bleeding between menstrual periods, or after sexual intercourse. In both men and women, chlamydia can cause rectal itching or bleeding, as well as anal discharge and diarrhea. However, chlamydial infections are asymptomatic most of the time. To diagnose chlamydia, a test is required. For women, screening involves a cervical exam with a swab sample. A urine test can also suffice. For men, a urine test is now equally effective and less painful than the traditional urethral swab. Chlamydia is easily treated with antibiotics. You need to take the full course of medication and refrain from sexual relations, oral sex included, until the treatment is complete. After symptoms disappear, the infection can linger in the body and still be contagious. To break the chain of infection and to avoid being reinfected, you need to alert all your sexual partners within the previous 60 days and encourage them to get screened and treated if necessary. Your doctor can assist you in using our anonymous partner notification service. Some effective ways to prevent chlamydia are practicing safe sex by always using a condom, avoiding sexual relations under the influence of drugs or alcohol, and limiting your numbers of sexual partners. You also need to get screened regularly for STIs. Your sexual health is important to us and to you, so have fun, but be safe.